COVID-19 new challenges in when the patient enters the dental office, we have to know what are the main symptoms of coronavirus COVID-19 infection. They are difficulty in breathing, cough, and fever. Any patient having these three symptoms have to be given an appointment that is very far and ask the patient to seek help about his infection. Spread of aerosol by air in the closed rooms. If an infected person coughs in front of a non-infected patient, if there is distancing around about 1.5 meters, the aerosols need a couple of minutes to reach the non-infected person. And it will take around about 15 minutes to reach another person who is about 10 meters away. After that, the aerosol will spread in the air of the closed room. The heavier droplets, about 5 microns in volume. They are very heavy. They will start to descend to contaminate all the surfaces in the dental office. The lighter droplets will be airborne to reach the very remote patients or escorters later on. So after 10 to 15 minutes, we will see that the dental office is fully infected and the surfaces are contaminated. So we have to ventilate the room efficiently, wipe as many surfaces regularly by a disinfectant as sodium hypochlorite, and never keep room closed, because if we keep the room closed, the load of the virus will increase, and this is really very important. We have to decrease the load of the virus in the environment, and we do that by opening up any balcony or any air ventilator. It's important to keep the room open. So, social distancing, this happens in the outdoor, whereby I've got still air, but in the dental office, whereby I've got air conditioners and fans, they will move about the air, so I don't have what we call social distancing. It's important that I ventilate the air in the dental office routinely and regularly. Management of patients in the dental office. First of all, we evaluate the patients for temperature of all the staff and the patient. No companions are allowed to enter with the patient. All the patients and even the companions outside the treatment room, they have to be provided with medical masks. In the oral examination, any procedure inducing cough should be avoided. Preoperative antimicrobial mouth rinse as chlorhexidine is important to disinfect the oral cavity. Extraoral dental radiography is important and it is recommended to be used. Four-handed dentistry is very important because the dentist and the assistant are going to work together. They shorten the time of dental treatment and minimize infection by organizing the treatment. So the dentist has to be behind the patient so that the patient, if he coughs, he will cough in front of him and it will be away from the dentist and the uh, assistant. Treatment of emergency cases, it is imperative that we use a rubber dam because when using a rubber dam, we will isolate the oral cavity from the area or the field of treatment. The turbine, when drills the tooth, it will make aerosol of the tooth and the field, which has limited uh, virus if it is present. Chemomechanical caries removal should be considered at such times because we don't want to use aerosol generating turbine and triple syringe. Even though we don't like toxic devitalizing agents like tricrysol, formalin, and phenols and CMCP, but maybe to devitalize a pulp that is very painful, we may use this temporarily just to sedate the condition and give the patient another long visit. When placing a temporary filling, we have to use a temporary filling that will stay for a long time, like glass ionomer cement, because we have to do the short treatments and place the TF that will stay for a long time. So routine temporary filling will not be beneficial and GIC is better. Any patient needing extensive tooth drilling should be scheduled as the last patient to decrease the risk of spreading the infection. Lastly, all biomedical wastes, they have to be carefully disposed through an authorized biomedical disposal agency. To protect the dental staff, the personal protective equipment, PPE, now they are a must. Face shield, goggles, N95 respirators, the gown, and the gloves, they have to be worn. If a person is infected with corona and he does not have a mask, and we have a mask, the possibility of our infection is 70%. If the patient or the corona patient is wearing a mask and we don't wear a mask, the possibility of infection is 5%. But if both of us wear a mask, the possibility of infection is 1.5%. So it is imperative that all should wear masks. The N95 respirators, they are very nice because they make a very close facial fit and very efficient filtration. They block 95% of the aerosol droplets, but they don't completely eliminate the risk of infection. Of course, they are much better than the surgical mask, whereby the droplets may seep behind the mask. So N95 is much better. N95 may be disinfected by 75 centigrades for 30 minutes and recycled at least 20 times, and no degradation to the filtration efficiency happens. This is a research by Leo et al. In 2020. N95 respirators, if they get contaminated by blood or any secretion, they have to be discarded. Modifications for maximum protection, we will see that there are all sorts of shields for maximum protection. They are very beneficial. Or we may have a glass compartment to seal the patient and decrease the aerosol from being contaminating the dental office. There are many modifications nowadays that are very efficient and easy and cheap, like this plastic, transparent plastic sheet, and we make a hole inside, and we place our turbine, and then we place this sheet on top of the patient's oral cavity. We start drilling, and the sheet will prevent the aerosol from contaminating the area. The aerosol vacuum device, this is very nice. It has a power of vacuum of 200 meters cubed per hour. So if I've got a small room, the air in this room will be filtered 4 times per hour if I keep the device on. And in a large room, it may be filtered twice. The device has to be very close to the patient's face. The aerosol will be sucked by this device efficiently, and the device has got 3 filters whereby it filters the droplets of the aerosol and extruding air devoid of any aerosols and droplets. It is important to use social media as teledentistry for communication between the dentist and the patient, starting with the first diagnosis, then with giving all the knowledge and instructions, and even certain prescriptions of drugs like sedatives or analgesics, and development of the dental protection. Here there will be a change from the routine as we used to in the dental office. Now we take things more seriously, and in the very near future, if it is it is now, maximum protection with the PPEs to us and the dental assistant, and with maximum understanding of the condition of the patient. Thank you very much.